just in the economics of medicine in the US, specifically the insurance system, there's this pressure for doctors now to see 4 patients in an hour to make ends meet. And essentially, when you have 15 minutes with a person, you really have no time to fully understand them. And so instead of like these longer conversations about their relationships, their meaning and purpose, their physical health, the way they use their mind to navigate problems, areas where you could kind of dig in and help them improve. All of that was wiped out. And essentially, we just use this checklist of symptoms now, where it's like, oh, you have 5 out of 9 symptoms, you have major depressive disorder. Oh, and by the way, we have this FDA-approved treatment that's going to fix it, an SSRI, an antidepressant.
And by the way, for the people that don't know what an SSRI is, because we hear terms like benzos and SSRIs, and how would you explain that to somebody who doesn't know what that is?
SSRI is a drug that blocks serotonin in the brain, and it produces a numbing effect, essentially is what it does, where it reduces your emotional range. And what that means is like you don't go as low, but you also don't go as high. It kind of constricts emotions. And that can be really therapeutic. Like if you're having like a lot of anxiety, or you're super distressed, having something that kind of sucks that in can be helpful, but it's not getting to the root cause. Oh, and by the way, SSRIs, that's like Prozac, that's Lexapro, that's Zoloft. Those are the drugs people are usually familiar with. And so it's essentially like a Band-Aid over a problem rather than kind of getting deeper into it. And so that's what I saw. I saw very limited time to understand patients, defaulting to using medications, because when you have 15 minutes, you're not going to really work with someone with their physical health and motivate them to do that. You're not going to talk to them about their relationships or meaning and purpose. You don't have time. You're going to go, do we go up on the dose? Do we go down? Do we stay the same? Like that's kind of how things have veered in medicine for mental health. And I would talk to my professors about it at the time. And I'm just like, this doesn't make sense. How can we really expect to help people if we don't even have the time to understand their lives or even implement these solutions? And they would say, Joseph, don't worry about it. These drugs, they're safe and effective. They're approved by the FDA, nothing to see here. That got really under my skin because intuitively I was like, this doesn't make sense to me. It feels off. But I was like 26 at the time. And I wasn't an expert in psychiatric drug research. And so after residency, I went and did a fellowship in psychiatric drug development. This is like super specialized advanced training after that. And I worked for Johnson & Johnson, and they have a pharmaceutical branch called Janssen, which historically have developed the majority of the psychiatric medications. And so very well established. And I was on the clinical development team running the clinical trials for antidepressants, kind of learning how they studied the drugs. And then after that, I went and worked at the FDA in the division of psychiatry, where I was looking after multiple different drugs across the US market. From that vantage point, you get to really understand like all of the steps that go into bringing a drug to market, phase 1 studies, animal studies, the big clinical trials. And what I saw then was essentially that we are practicing so far outside of what the evidence base supports with these medications. And while there's a lot of issues that I found, the one thing that I would really want your listeners to be aware of is simply the duration of the clinical studies. Now, most people taking antidepressants or any psychiatric medication for that matter, they're on them for like a median duration of 2 years. And obviously we know some people are on them for decades now.
Yes.
Not a single study that I've seen for antidepressants has gone longer than a year. And so there's this huge mismatch between like how long they're studied for in the clinical trials compared to how long people use them for. And this is really important. And the reason that's important is, firstly, doctors, they don't tell patients this. They say, oh, the drug is safe and effective, but they leave out the part of, hey, for the year that we studied them for. That's important for people to know.
Yeah.
And the other thing is these drugs, they wear off over time. Everyone has seen this before. If you put someone on Prozac or Lexapro and it kind of constricts their emotional range and they feel a little bit better, that person's back in 6 months needing a dose increase, and so on and so forth. And what I used to see in my clinical practice was after a couple of years, they're maxed out on the dose. It's not really doing anything. And so that's the one thing that they're not telling them, that the drugs are wearing off. And then the other thing that you need to be aware of is that doctors don't like it when I say it like this, but these drugs, they change your personality. And so, what are the impacts of being on a drug for several years where it kind of blunts who you are? It sort of blunts you to your ability to really emote and connect with your emotions and connect with others. That also has ramifications in your life. And the final thing that I'll mention there is that, the human brain is essentially not designed to be in a drug state day after day after day. I've also and what I also learned when I was there was that people actually can get sicker on these medications over time. And then instead of that being recognized by doctors, they tell them they've developed a new psychiatric condition. And then the person gets more drugs and they get stuck into the system. And so I kind of go on this journey where something feels off with how we're treating them. I learn the clinical research, and then I feel completely at odds with my profession because I'm like, this doesn't really make sense what we're doing. How could I find a place for myself while still being a psychiatrist? And so 6 years ago, my wife, also a psychiatrist, we decided that, what we're going to do? We don't really believe in like the long-term drugging of people. We're going to build a clinic that helps people safely come off psychiatric medications.
Wow.
And then we're going to teach them all of the non-drug approaches for their mental health, which they should have been offered in the first place.
Wow. That's unheard of, I have to say. And you're also the only one that I've seen on social media that is promoting this as your life purpose, which is amazing.